Diabetes is a condition where your body isn't producing enough insulin or isn't using that insulin effectively enough. So you require either lifestyle changes or treatments to prevent long-term conditions. So once you've been diagnosed with diabetes, you'll have either type 1 or type 2 diabetes. No matter what type you have, the risk of long-term complications is the same. High levels of glucose in your blood affect all your blood vessels, and all your blood vessels link to all your organs, so diabetes can affect any area of the body. We know that if we keep your diabetes well under control, we can minimise these risks of complications. We know that you only spend a very short period of time with a healthcare professional and the rest of the time you're on your own. So what we do is structured education for both type 1 and type 2 diabetes. Type 1 diabetes, the structured education is done by us as specialist nurses, and we locally have a course called Choices, which is looking at carbohydrate counting. If you've got type 2 diabetes, we have a local structured education programme called Diabetes Essentials that's run by the dietitians. The main factor in type 2 diabetes is looking at your diet and lifestyle, and in particular making sure that you're reducing carbohydrates, which turn into sugars. Because of the risk of long-term complications, we get anybody with diabetes to have an annual diabetic review at the GP practice. So even if you're under secondary care or other specialist nurses, you still need to see your GP or practice nurse for a diabetes annual review. So very similar to your car MOT, it gives you the indicators as to whether your diabetes is under good control and what you can do to minimise your risks in the future. To reduce the risk of long-term complications, it's really important to keep your blood glucose levels under control. With lifestyle changes and support from your practice nurse, if you've got type 2 diabetes, it is a progressive disease. It is going to get worse over time, unfortunately. So the likelihood is that you will need treatment adding in at some point if you have type 2 diabetes. But once you're on treatments, it's making sure that you're taking those treatments at the right times, on the right days, and making sure that you have the follow-ups and carry on with the diet to make sure that we keep your blood glucose levels as tight as possible, and that should minimise any risk in the future. Type 1s with their insulin regimes still need to keep their control tight, but they're just doing it slightly differently with insulin rather than dietary measures and tablets. If you're needing more information on diabetes in general, Diabetes UK has a very good website that's research based and has a lot of useful, patient-friendly information.